Today on the Surviving the Human Experience podcast, we will be taking a journey with an amazing woman who is on a mission to assist others with reclaiming their health and optimizing their overall wellness. She is doing this by sharing her powerful story and educating others on how holistic wellness can have a profound impact on health. I'm excited to have Dr. Wendy Holland with us today to share her story and her message. Before we jump in, I'd like to share a little more about Dr. Wendy with our listeners. Meet Dr. Wendy Holland. A lot of acronyms here: DNP, MPH, FNP-BC, APRN, a nurse practitioner whose life is an epic saga of compassion, grit, and transformative impact. Armed with a doctorate from Duke University and dual master's degrees from Johns Hopkins, Wendy's academic prowess is rivaled only by her audacious quest to revolutionize healthcare. As the visionary behind Liberty Advanced Integrative Care in Charlestown, she's crafted a sanctuary where patients don't just heal, they soar. Wendy's 32-year odyssey spans continents, from delivering care in underserved African villages in Tanzania to empowering urban Native Americans in Seattle and shaping U.S. healthcare policy. A Navy wife and mother, she's mastered the art of turning military's life's chaos into opportunities for service, and her direct pay client embodies her fearless mantra: healthcare must be personal, proactive, and deeply human. Patients don't just see Wendy, they join a vibrant movement towards wellness. As a second-generation educator, Dr. Holland pours her soul into mentoring future nurse practitioners. She urges them to seize opportunities and lead with love for their patients, themselves, and their communities. Living with chronic medical conditions, Wendy has faced gaslighting and dismissal from medical peers, experiences that ignite her mission at Liberty Advanced Integrative Care. To find the care she needed, she had to be seen and heard, a promise she now fulfills for every patient, ensuring they feel valued and empowered. From confronting global health crises to celebrating each patient's progress, Wendy's work is a masterclass in impact. She's not just a provider, she's a storyteller, mentor, and a force of nature, championing every patient's right to author their own comeback. So you can connect with her, and we'll share at the end of this episode how to connect with her at Liberty Advanced Integrative Care or Norwich University, where she's shaping the future one life at a time. So welcome to the show, Dr. Wendy.
Hi there. Good to be here.
Yes, we are so excited to have you on because I know that you have so much knowledge and wisdom to share with our listeners. You have a very powerful story that sheds light on a lot of the limitations that many in our health and wellness space experience when it comes to healthcare. And I always like to give our guests an opportunity to share more than what I did. Your bio is amazing, but I want to, allow you the opportunity to share with our listeners who you are, how you got here, and talk about our topic, what we're going to cover today, which is the quest to revolutionizing healthcare. So tell us a little bit about how your journey began.
So I've been in healthcare for a long time, but the journey for the clinic has sort of been that little maybe in my head for a long, long time. But it wasn't until I was sick and got no care, was dismissed and gaslight, that it really started to come to fruition. So at the beginning of my miserables, in June 2016, I was driving home from work like I normally do. I have a long drive from where I lived in downtown Seattle. I worked in downtown Seattle, lived in northern Washington State, and I stopped at my usual gas station, got gas, and drove home, knowing that the next couple miles there was going to be nothing because it's northern Washington State. There's a whole bunch of ain't and squat. And in that time, I started having trouble breathing, I started getting tunnel vision, and I basically just prayed that I got to the next gas station, which was about 10 miles away. I basically mantraed myself there. And when I got there, I had the gas station attendant call the ambulance, and that's basically when it all started. I proceeded to go into the ER 6 more times, had a full cardiac workup, all with these same tachycardia symptoms, lack of problems breathing, and just nobody could put a finger on it. Everybody was like, it was a panic attack. And I was like, the hell, it's a panic attack. That's not the world I live in. Like, I used to do trauma. Like, nothing phases me like that, except when it's my own healthcare. Had a full cardiac workup, got seen by endocrinologist, met with my primary care multiple times who had known me for 20 years. So it wasn't like I was a nobody. She knew me and still wasn't getting any care. And I basically had figured out how to manage it with food because the labs were trending. And I was like, okay, well, I can figure this out with labs. And I'm up to my eyeballs working on my second master's at this point. So I'm doing all the research. And so when I had providers who would say, "Oh, this is anxiety," I was like, "The hell this is. My potassium's 2.9. You show me the research where it says a potassium of 2.9 equals anxiety, and I'll believe you. But it doesn't. It equals something else. Now knock it off, do better." And so there
Mm-hmm.
was a lot of pushback, which of course then I was started getting dismissed. And I was like, I'm your peer. Like I'm another medical provider. I'm not some, I'm not a garbage man. I'm not a house. I mean, I am a housewife sort of, but I am a medical peer. Like I can do the research. I'm good at this. I'm published. Like, what are you talking about? Don't you dare gaslight me. Shame on you. And I had, they're like, you need to be in counseling and you need psych meds. And I was like, okay, well, so I bought the psych meds and they would sit on the counter and I would hold them in my hand and go and sort of think about them going, do I need this? Nope. Put it back down and go about my life, trying to figure out if this is what I needed. And I was a good provider for the most part. I did go into counseling because I was like, well, if I'm not going to take the drugs, I at least have to go into the counseling so that they can't say I'm not doing my part.
Right.
So I did that, which was beneficial. I feel like everybody probably needs a tune at that. Both at that point, both my parents had passed away. My husband had been in multiple deployments. I had kids. Like I definitely had issues too that having some time at counseling would definitely be helpful for. So I didn't want to deny myself that, but I also didn't want to put myself in a position where they say she's non-compliant with that plan. Okay, enough. So I complied with it enough that they kind of left me alone. And still, and when I left Washington State, which was about a year and a half after this started, I still didn't have an answer. And it
Mm.
wasn't, but I was managing it with food. I was able to keep my potassium up, but I didn't have a why. And once you get the why, then you can start to treat it. So I got really good at managing, what foods were high in potassium, what foods were high in salt. How do I keep my blood pressure up? Because I would get these palpitations randomly. And of course, 2 o'clock in the morning is the worst time to get it.
Yes.
Yeah. So when I moved to Virginia, because the Navy said go east, and so we did, we moved to Virginia, but moved to Norfolk. And one of my friends had knee surgery. And so this was her debut race after her knee surgery. She used to run races all the time, and we were just going to walk it. So it was going to be me and my sons and her just to see how it all went.
Mm-hmm.
And we all did fine. We had a great time. It was on Virginia Beach. We had a great day, went about our day. And I was like, okay, cool. Like I am in a position where I should lose weight. I should exercise more. I just started this. I'm just going to keep going. And so I'm
Yeah.
a big fan of low carb dieting. It's been very successful for me. So I just jumped right in. So the next day I had what I would consider a low carb breakfast and went about my life, doing whatever I do on the weekends. And generally every Sunday I would go to the grocery store to go pick up stuff to get ready for my kids for schools, lunches and all that junk. And I had another episode in the car. With my kids. And so we were still in the parking lot of the grocery store. And so I gave $20 to my son. I said, go run in and get me V8 juice because V8 juice is high in potassium and sodium and has some carbs. So I would tickle all those itches really quickly. And so I chugged 3 cans of V8 juice, roughly 36 to 40 ounces of V8 juice. And I was like, this isn't stopping, which was one of my go-tos. V8 juice and coconut water were my treatments, one of my consistent treatments that worked. This isn't going anywhere. So I called my friend who was the one we did the race with, who's a nurse. And I said, I'm in trouble. I need help. This is where I am. She's like, I'm on my way. And she brought her husband. So her husband took my kids back to my house, which was right down the road, fed them, took care of them. She took me to the hospital. And I went in and all my electrolytes were all screwed up again, despite the fact that I just chugged there are 3 cans of V8 juice. Everything was all screwed up really badly. And I was like, that is it. I have had it. And I remember that night just crying and just being driven to my knees going, God, either kill me or make this stop because I can't have my family keep watching me being taken away in an ambulance. I can't
Mm-hmm.
have them watch me have all these horrible procedures. I can't have them see this anymore. Like one of the procedures they wanted that they did eventually do was I feel like they cardioverted me for sport just because I never had a funky arrhythmia. I always had true tachycardia, which doesn't require a cardioversion, but the ER doc and the cardiologist conspired and they're like, okay, well, if she shows up again, we're gonna cardiovert her. And so they did that. Just about before they did that, I was like, you have 20 minutes to get this done, because if my husband sees this, he's going to die. So hurry up. So this was traumatizing to my whole family. My children were all young. And so I couldn't do this anymore. Within
Mm-hmm.
about 48 hours, the direct pay doctor, I started looking for a new provider, and the direct pay doctor sort of showed up in my Google. And I said, what have I got to lose? I don't care. I got to have
Right.
more skin in the game, because this has got to get better. And she
Mm-hmm.
was the first one who was able to take the time to listen to the story. Because if you go to a regular doctor that's paid for by your insurance, you have the 15-minute wham bam, thank you, ma'am appointments. I can't even tell the first 20 minutes of the story before they're like, goodbye, we're now late, get lost.
Right.
So she took an hour, she listened to the story. I had my follow up, we drew more labs, and then she started putting me in the hands of the other providers, the ones that were able to also take the time to listen to me. And
Mm-hmm.
from there, then I found a functional provider who treated me for a while. And then he was like, okay, you've been to all these people. He's like, we're missing some piece of data. He's like, I want you to go see this chiropractor. You can't even find her. You can't Google her. You have to know a guy to get to her.
Mm-hmm.
And so I did. And she was the first one who's like, I see you. I know what you have. I want you to go see this cardiologist and this endocrinologist. And when they bring their reports back, we'll be able to diagnose you. And lo and behold, I came back with a diagnosis of POTS, postural orthostatic tachycardia syndrome, which was sort of the driver of all the tachycardia and the nonsense, which was then overlaid with Ehlers-Danlos, which I was kind of suspicious of at that point. I didn't know that I had it, but I was suspicious. And then that once I started treating that, then things started to get better. I had an endocrinologist who was doing medications a little bit differently with me. He did a whole bunch of experimental tests to make sure we were ruling out like Cushing's and stuff like that, to make sure if we started me on meds or a supplement program, that we were doing the right meds and supplement program. And then things got markedly better. So that's sort of how it started. And then when we moved again, Rhode Island, because again, the Navy says move. Then when we
Yes.
moved to Rhode Island, I found another provider up here. It was sort of through the Ehlers-Danlos network. Go see this guy. Sort of he was an expert. And that was the guy who sort of rounded out all my diagnosis, who was like, you do have POTS, you do have Ehlers-Danlos, you also have mast cell activation syndrome, which explained why I would get these sort of spontaneous attacks. And then he added Derkham's disease, which is considered a rare disorder by the National Organization of Rare Disorders at the federal government. It's a lipidemia or disorder, which explains some of the surgeries that I had to have, because I had a random fat glob that hardened under my index finger and it hurt like hell. So it explains some of the other things. But it took forever from the time by the time I had my first attack to the time the picture finally came together was probably close to 6 years. So I'm in healthcare, and I've got
Mm-hmm.
access to everything that Johns Hopkins has. I've got access to everything that Duke has. I was constantly reading, looking consults, calling in favors. And when I look back going, if it took me this long to get a diagnosis, there's no help for anybody else. There's no hope. You guys, everybody who's not a clinician is just hosed, because there's no way. If I have to suffer this hard and I'm in the system, everybody else is just screwed. So that's sort of how this all fell out. Like, there had to be a place for those who are not seen get seen, and somebody can slow down and take the time, listen to the story, think outside of the box, or think that though no box exists, and start
Right.
over. So
Wow. What a
yeah, and there was
story.
there's was lots of pain there. Like, I've had miserable tests, I've had gallons of labs, miles of EKGs. Like, I should glow with the amount of radiology I've had, and I'm still here and I
You're still
persist.
here. Yes.
So
You're still here. You have a mission, you have a purpose, and it was
mhm.
to address those who have what I like to call the mystery symptoms and conditions that nobody can figure out, and everybody wants to go for the obvious.
Well, everybody wants to say it's anxiety. And yes, anxiety can manifest in many different ways,
Yes.
totally. But like, it's not everybody, every place, all the time, every day. Like, come on,
Right.
let's do
Right.
better, guys. So
Yes. Yes. Yeah, I too remember days very similar where I'd be sitting still and all of a sudden that heart rate would go up to 170 something, and they'd say, "We have no idea what's going on. You're not on a treadmill." I'd literally be sitting at my desk and this would happen. And this was after the birth of my second child. And
Mhm.
they wanted to do the blood pressure medications. They said, "We've got to regulate that." And I'm like, "So you want to treat a heart rate that increases with no reason or rationale, no heart defects, nothing that makes any logical sense." So I was similar to you. I took the medication. I was very polite because you don't want to be a non-compliant patient. And I put it right on
Oh,
the
sure.
counter. And I said, "No, that doesn't even make any logical sense." They never figured it out. I went about my life and, things
Well,
just
they gave me,
manifested.
yeah, they gave me a blood pressure pill. They gave me metoprolol because that'll slow down your heart. And
Yes.
I took half of one, and I felt like I had a lobotomy. And I was like, I can't even handle myself. So I had to
Right.
lay on the couch for the rest of the day. And I was like, this has to stop.
Yeah.
As a result of that, I ended up studying herbalism. So while I was out in Seattle, like one of my coping mechanisms was to just go outside. I was like, I can't handle this. I need to go do something else. So I started studying with the Cedar Mountain Herb School, which was in Washington State at the time. It's now in Idaho. And that was not only my way to learn other ways to do things, but it was also, those were my people. Like
Mm.
those were all people who were in alternative med. It was majority of the group class was women, and I just found my people there. And so some of my closest friends were people I tromped around the woods with and got
Yeah.
lost and found all sorts of plants and made medicine and did all the things, and that was very helpful. They sort of kept my head on screwed on straight while I went through all the nonsense.
I
So
love it. The story is so profound, and I know it was a lot of pain and stress and torture for you. But the silver lining is that
yeah.
somebody who is credentialed to your level has the attention of others in the communities. And so for all of these voices that you're referencing that are just swept under the rug, you needed to be there to champion and to be a voice for those who have been pushed aside and made to feel crazy and lost hope and are living miserably every single day because they're on so many meds that we've put so many band-aids on problems and never even figured out what the true cause was. We're probably causing more harm than good with all of that stuff. So,
Well, and I feel bad for the clinicians that were taking care of me to a certain degree
mhm,
because they were under, at their respective institutions, were under the gun of, treat and street. Get everybody, get in, get out, quit screwing about. And I get it.
yes,
That's money. It's all about turning tables. The reimbursement rate on a visit is very low, so you need to go for high amount of visits, but the amount of work for each visit doesn't change. So that means you cut out time with the patient to figure out, to make a relationship with them, to figure out what's actually going on. Like, and that's the problem with healthcare right now. Like, we are not afforded the time to get to know our patients, to actually understand them. Like, I've got patients who are a mess, and I've got patients that every time they come in I have to block out 2 hours because it's going to take a while for the train to get going with their story, to get to the
right.
meat of the story before I can go, okay, now I know what's wrong with you.
Hmm.
And like, healthcare right now is struggling with this because it's all about turning tables, and it's not helping patients. Like, if you come in with a bladder infection, that surely takes 15 minutes, and you were waiting for the lab more than anything else on that one. But that is so pedestrian, and that is so not common anymore. We now have people who are very, very ill. The population is certainly aging. I don't even know what is the ramifications significantly of COVID and the COVID vaccines. There's all these rumors about that. So healthcare has gotten way harder. It is not any easier than it was years ago. In fact, it's harder still. So the clinicians are struggling themselves. So
Hmm.
it's all over the place. So
Hmm.
patients are sicker, and the institution is not supportive of taking the time to figure it out.
Yeah, it's become a business model more so
It's
than
absolutely a
human
business.
human centered and human centric. So
Yeah.
in your story, you covered a lot about that health perspective and you briefly touched on the mental aspect. But just going a little deeper, how did this all affect you emotionally and mentally as you were going through this process?
Oh, it was really hard. There were some days at 2 o'clock in the morning, I was like, I can't handle this anymore. And I'm
Hmm.
very strong. Like, I have been through some stuff. I used to work trauma. Like, I'm good when it gets really bad. And so for me to get to the point where I was like, I'm gonna quit. Like, I'm
Mm-hmm.
going to quit and I'm just going to be like, roll over and die. Literally, I was okay with that because I would stop everybody else's suffering if my suffering stopped. And it's a dark hole to get to. And I remember talking with one of my girlfriends going, I can't take this anymore. I can't keep putting my family through this, and I
Mm-hmm.
can't handle this. And so, like I said, I went into counseling because I was like, I have to do something. Like, I have to be compliant with the plan. But oh,
Right.
by the way, it definitely, exercised some demons for me and allowed me
Mm-hmm.
to address some things. So I definitely got a benefit from it. Like, I'm not
Mm-hmm.
poo-pooing counseling at all.
Mm-hmm.
And then, like, finding my people at the herbalism school, like, that gave me an outlet. They were not clinicians, they didn't judge me. They were there with me through a lot of stuff. I mean, like, when I had to go get an MRI, they came with me, they held my hand, they took me there, and it was just a different group of people. And it wasn't my nursing peers. While they were all lovely, I needed somebody different. I needed
Mm-hmm.
people with different perspective who saw me differently.
Mm-hmm.
I feel like I'm repeating records, but it just needed something different. And
Mm-hmm.
so
Mm-hmm.
I had to seek out the difference. And, being outside for, 8 to 10 hours every Tuesday was a godsend.
Mm-hmm.
You know,
Yeah, just connecting to that earth and being able to ground yourself. I was going to
Mhm.
ask you how you managed and regulated the emotions because it's heavy. And it sounds like you were able to do that through what are
Mhm.
perceived to be non-traditional ways. But I'm glad you
Mhm.
share that because for our listeners who may be in similar situations, I think that's, important for people to realize you can push through, you can make it through. You just have to take a different approach.
When you don't want to isolate, like, that's the worst, because then you just spin on yourself what's going on in
Mm-hmm.
here. And it doesn't matter what is going on in here. When you're all by yourself, it's just doom and gloom and horrible. And so there were days when I was like, I would show up and I was like, I'm messed up. I just need to be here to unscrew my head. And they'd be like, okay,
Mm-hmm.
cool. Let's go jump in the car. Let's go get in the dirt. And,
Love it.
eventually things would sort of get out, whether it was I was touching plants, I was out in the fresh air, we were up in the Cascade Mountains at elevation. Like, there's no cell phone signal up there. So,
Mm-hmm.
the whole world could have crashed around and I wouldn't have had any idea I was out, looking for any number of plants.
Right.
So it just let me unplug and do my thing.
Yeah. So for our listeners who are currently caught up in that healthcare hamster wheel, what words of wisdom or encouragement can you offer?
Persist, keep
Mm-hmm.
going. There are providers out there. There are fortunately not enough of the me's out there,
Mm-hmm.
but I feel like there will be more coming. I'm independent of politics. I'm very hopeful with the new things that are going on with HHS. There's a lot of people in the alternative healthcare space that now have a table at HHS, starting to, the chiropractors have now showed up at the table. The regenerative medicine people have now showed up at the table. They weren't even allowed in the building before, and so now they're at the table. So I'm very hopeful that the alternative medicine people are going to have a voice, and that will allow increased opportunity for patients to get
Mm-hmm.
stuff that they need, because not everybody needs the 15-minute, I have the respiratory crud of the day or a bladder infection.
Right.
Some people need somebody who can dig in and commit and walk with you for through the nonsense, which just
Mm-hmm.
takes time.
Mm-hmm.
So just keep
Yeah.
going. There is somebody, don't quit. There is somebody out there.
Yeah. A lot of it I've seen more recently seems like it's a combination of soul work and health all at the same point in time and space. And so offering that alternative approach, I think really helps people dig in and do the work and do
Mhm.
healing on a whole different level. So let's jump into a somewhat sensitive topic. We'll stay safe here, but
We're good.
healthcare models. Yes. So you referenced the insurance-based healthcare machine
Mhm.
versus the direct pay provider healthcare model. Can you,
Mhm.
for our listeners who might be trying to discern what the difference between the two is, can you explain that and elaborate? I know you touched on it a bit, but just elaborate a little more.
So the insurance-based model is basically you have a card that you can take to any provider that's in your network. If you have an
Mhm.
out-of-network provider, you should know what your out-of-network provider benefit is, and you can go see Dr. Bob, Dr. Sally, whomever. You use your insurance, you get the services they need within your network, and you are limited by your network. Some networks, depending upon your plan, like if you have a PPO plan, that's sort of the I can go anywhere all the time. I have a higher financial commitment because it's usually a percentage, not a copay per se. You have a percentage to pay, and you can do anything you want. But then there are some where, like the HMO, which is much more restrictive. You are required to stay within network. You're required to participate with their providers only, but it's much more cost effective. If you're very healthy, like the HMO plan is great. The moment you have something going on where you are concerned that you don't have enough people on your team or you need more opinions to manage you, the PPO plan, while more expensive, gives you much more latitude and you can go see whatever provider you want. So that's the insurance-based models in a nutshell. Then you've got the direct pay. Let me go back. Then you've got the concierge model. So the concierge model is like the direct pay model where you pay a fee every month to go see that doc and they're your person. This is a relationship that's independent of the insurance. So they, generally speaking, they don't take insurance. However, the concierge people, not often, but not always, but often, will also go and hit your insurance at the same time. So you pay a couple $100 a month or a couple $100 a quarter for access, but they usually give you some additional benefits for it, and then every time you come in they also run your insurance at the same time. I don't do that. I do direct pay, which means my patients pay me every month, every quarter, or for a package, because I do have some plans that are packaged. They pay me for that, and the relationship stays between me and the patient. There's no third party involved. There's none of that nonsense. It's not that there's anything wrong with insurance. I have insurance. I want the time to take care of my patients. And if I've got to deal with the pittance of reimbursement from the insurance companies, I will not work. Well, my clinic will close. The reimbursement rates in Rhode Island are horrendous. We're actually out of 50 states in the country, we are dead last for reimbursement.
Wow.
So, it's terrible. Like I can't even pay. If I saw 4 people an hour, which is crazy talk, and I could not pay for myself per hour. So that doesn't even count my rent, my electricity, the person who helps me here, supplies, nothing. I couldn't even pay
Mm-hmm.
myself. Um,
Wow. Mm.
it's terrible. So concierge providers will have a monthly fee and they'll hit your insurance. Direct pay providers don't hit your insurance. Now they will provide you the paperwork that you can go see if you can get reimbursement through your insurance. Like you basically,
Mhm.
there's usually a form to fill out for an out of network provider. You fill out the form, and generally speaking, not always, but generally speaking, you will get a percentage of your money back, and it'll be paid to you, not to me, because you already paid me. So it's a little bit more cost effective. For the direct pay and concierge clinics, you generally can use your HSA and FSA dollars for that, just like if you were to go to CVS and buy Tylenol, or, go to the chiropractor, we'll go to your co-pays, your dental cleans,
Mhm.
whatever. You can use that. That has been accepted by the IRS as an acceptable medical expense at this point. They can always change and whatever, but at this point, it's acceptable. So those are basically the models.
Okay, awesome. Thank you. Because I
Of
know that
course.
some people get confused on, well, what does it mean for direct pay and what does that look like? And I think
Mhm.
it's important for people to explore that option because initially somebody may feel like, oh, no, 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 I have to use my insurance because it's a model that's so familiar. And so being able to transition into something else and understanding the whys behind why it makes sense. And if you do need that extra support, yeah, it
I
opens
will use
doors for you.
I will use people's insurance, like if I send them for an X-ray or a CAT
Uh-huh.
scan or labs. If I can get the lab to run your insurance, I know that saves you bucks. Like
Mm-hmm.
the first set of labs that all my patients get is a multi-thousand-dollar panel of labs. For the most people, it costs them a couple $100. But we're looking at things that have not been looked at in that patient ever.
Mm-hmm.
And then after that, then we can add functional tests and all the other stuff. But I try and use their insurance when I can. It just isn't going to get used under my roof.
Right. Makes sense. So, can you share how being a direct pay provider, how has this creative approach allowed you to meet the needs of your patients, but then also your own personal mission?
Sure. So for starters, my patients, when they make an appointment, they get a free 30-minute just meet and greet. Like no money's exchanged. So I'm giving 30 minutes away of care and advice and sort of understanding what's going on with them even before we get anywhere. Most people generally walk away with some input as to what's going on. Like you could do this, you could do that. And that's just free. I do that because I want to help people regardless.
Hmm.
Then when people are like, yep, I'm interested. So we figure out, what do they need? Do they need primary care? Do they need like a package plan? I've got all sorts of different ways to help people. We figure out that, and then we schedule their first intake appointment. That's an hour at least. usually from the 30-minute sort of meet and greet, I can tell, oh, this is super complicated. I need to schedule them for an hour and a half. Sometimes it's even 2 hours. Bring them in, and I tell them, if you've got any labs, radiology, records from other providers, just bring it all. I will sort through it. I'll copy and scan in what I need, and I'll give everything else back, just so I have an understanding of what have you been through. And then at the end of that appointment, they go away with a lab slip to go to their local lab, whatever they choose. It's covered by their insurance. And then that takes about a month, because two of the labs, at least in the state of Rhode Island, have to be frozen and sent out of state. So that's the long pole in the tent for these labs. So they come back, that takes about a month. And then we have another appointment where we review everything. So I look at all the records that I scanned in, all of this stuff. If they've got something kooky that I've never heard before, by the time they come back, I've definitely read up on it.
Mhm.
And then we review all the things and come up with the plan. And from the plan, it generally, for most people, it takes about a good 6 months to get things going, as we sort of assess and tweak and assess and tweak and assess and tweak to get to, we'll try different meds, we'll try different supplements, we'll do different dietary stuff, we'll do lifestyle choices. And oh, by the way, sometimes it's like, I need a CAT scan. Or I need an ultrasound, or I need a something, because the labs say this, your presentation is this, and I can't figure out what the deal is. I need another opinion. I need an image. I need something else. Or it'll be like, your kidneys are absolutely horrible. I need to send you to nephrology. Or, between the first appointment and the second appointment, they went into the ER. So now we've got a whole new set of data. What happened with this patient? So it's this constant constant assessing and executing the plan as we go along to figure this out. It's never set in stone. To figure out what is the best way to treat them, because what's happened is most people come in and they're like, okay, here, you have anxiety, get lost, here's your prescription, and they're like, come back in 6 months.
Yeah,
What?
right.
I mean, I've had patients where from the meet and greet to the first appointment, they went into the ER and they started
Hmm.
sending me their records. And I was very grateful, because when they came for their first appointment, I have a completely different view of what I'm going to do with them because of the critical things that sent them to the ER.
Right.
So
Whew. So it's a lot. It's a journey. It's not as
it's a lot.
simple, just walk in the door and, it's the answer lies right here. But I love that you're able to tie your personal mission with wanting to help others and having a true, genuine interest in your patients, and not just, yep, I just want to I just want to check the box, and, no, not
Yeah.
at all. I love that. So you've been contributing to the healthcare industry in a variety of capacities. You've done missionary work, you've shaped US healthcare policy, you've started your own practice. So, in your personal opinion, with so much focus and growth on health and wellness industry, where do you see the future of healthcare going? And I know that's a loaded
Oof,
question.
that's a heavy question,
It
because I
is.
feel like with the new administration, I feel like there's a whole lot of good and bad that could happen. That's the benefit of where we are right now. So I'm not sure, but like I said, I'm hopeful that now that we've got somebody at HHS who wants to have more voices at the table, people who've been actively excluded at the table. I'm hopeful. I mean, and I've watched the healthcare industry. I mean, obviously my whole life, but when the Affordable Health Care Act came out, I'm fairly confident I was one of like three people in the United States that read all three versions. My husband was deployed and I wasn't working at the time, and so I had nothing better to do because my kids were little and they would take naps. That I would sit and read it, and I got really good at using Thomas, which is the search engine for the Library of Congress, and to figure out what was in this bills. And there was some good things in there, but there was a lot of things going, this isn't fixing anything. So how about this? Did you know that the number of physicians that are made every year is regulated by Congress? And do you know that that number has not been changed very much over the last 16 years since the Affordable Health Care Act came out? Um, so
Ooh, little
yeah,
factoid here. Yeah, so that
yeah. So
that
that has
shows
not
that.
changed at all. So yeah, so that needs to be fixed. In this, at the same time, the nurse practitioner schools and the PA schools have stepped up, but they don't have a governing body like the American Medical Association. So they I don't know, they have not done their job to make enough nurse practitioners and PAs, and the physicians are regulated by Congress, and we know how well they work. So
So it's almost like there needs to be a more evolutionary approach. So as we're
we need
seeing health
we need to make
experiences
more
change, yeah,
we need to make more providers because the Affordable
yeah,
Health Care Act asked more of the system without providing the tools to do the job.
makes
So
sense. Makes sense. We have a supply and
yeah,
demand issue.
yeah,
On the basic level, it's a supply and demand issue.
yeah,
Yes.
yeah,
So
absolutely.
let's jump in and talk about health a little bit. So you're an advocate of voice. We talked about this in the beginning for
Yep.
individuals who are in the process of reclaiming their health. I'd like you to share a little bit more about the mantra that you have. Healthcare must be personal, proactive, and deeply human. Can you unpack that a little bit for our listeners?
So obviously it needs to be personal. It needs to be catered to you. You can't take a template and apply it to every single person. That's hard to do. You need, and that requires study of the patient. Like you have to know what they're up to, what has been their experience, what have they gone through, what meds have they tried, um, what worked, what didn't work. On the flip side, it's hard. Like you can't sit here and use the model where everybody is faceless and nameless and say this applies to everybody because it's not. And everybody wants it to be personal. It goes with my licorice ice cream axiom. This is something I say to a lot of people. Licorice ice cream axiom dictates that everybody can like ice cream, but not everybody has to like licorice ice cream. So everybody can go to the ice cream store and you can like coffee and somebody can like cookies and cream and somebody can like vanilla and somebody can like chocolate. And there's going to be that guy who likes licorice ice cream. Now, for starters, you can't find licorice ice cream that often. I'm a big fan of ice cream. Ice cream. I've only ever found licorice ice cream in one place ever in my life. And I tried it because I was like, okay, my cousin loves it. And so I tried it and I know why I don't like it. I don't have to, dump on the people who love licorice ice cream. I don't have to go blow up the factories that make licorice ice cream. I don't have to do any of that. We can all sit at the table and like ice cream together. We can all like our different flavors. And so this is the whole personal part. We can all get care. We don't all get the same care. We all don't want the same care, but we can all get good care.
Mhm.
Proactive, you can't sit back. So you have to be your own advocate. I know we feel like we've been saying this for years. Um, and so you have to be your own advocate and not sit back and just be like, okay, well, the doc said I need this pill. I'm just going to take it. Like I tried that when, the doc said I'm going to take this pill. And so I would hold the bottle of the little pill and go, yep, this is still not working for me. The energy on this is bad. Forget it. I'm going to go do something else. But at the same time, I had to then concede is like, okay, well, if you think I have anxiety and I refuse to take the medications, I'll go into counseling. Like that was my concession towards their plan. I don't think I have anxiety, but okay, let's just try this. So I did, and it wasn't the worst thing I've ever done in my life.
Mhm.
And you just it has to be personal, it has to be proactive. You have to do all the things to take care of yourself because in the end, this is your body. This isn't the doctor's body, this is your body. So you have to feed it the right stuff, you have to do the right things within the bounds of what you have. Like if you have if you're on public assistance, you're not going to go buy organic grass-fed wagyu beef. You're not going to buy all the organic vegetables. Can you do good enough within the bounds of your financial situation? Yes. Can you do it all the same time at the same way as everybody else can who has money? No, but you can do good enough.
Mhm.
So yeah.
I'm glad you made that point because some do feel that it's unattainable when you venture down this road. And I can remember in my early journey switching from the traditional healthcare model going over into that holistic space, looking at the laundry list of, okay, I could take these herbs, I could take these supplements, I could, switch to all organic foods. And it can feel so overwhelming in the
You'll
beginning
bankrupt
because
yourself. That's silly.
yes,
That don't do that.
yes, yes. And your main goal is there becomes a sense of desperation in those dark moments where you're like, I will do anything to feel human again. And
Yep.
in that desperation, I think a lot of people get so overwhelmed that sometimes they pull themselves out of the game before they even start. So I'm so glad that you mentioned that there are
Oh, I used
little
to
things you can do.
yeah, I used to
Yeah.
joke that I danced naked under the moonlight if I thought it would make me better with all my nonsense, and I didn't care if I scared all my neighbors with my white butt. I was like,
Yeah.
I'll do anything right now. I don't care.
Yeah,
anything that will make me better, I'm for it. So,
I agree. I've done some interesting things myself in my day, and people are like, "Are you good?" And I'm like, "I'm fine. I'm just on a
mhm.
healing journey. Healing journeys look different for everybody." That's what I used to
It's
tell
not a
people. I'm
straight
like,
line.
"Yeah,
It's not a
it's
straight line.
not."
Everybody wants a straight line. You're just going to
Hmm.
continually get better. No, it looks more like this,
Yes,
just
yes,
all over the place.
yes, it does. And it's about the, as you mentioned, it's the persistence. It's having that drive to not give up until you figure out what works for you and knowing that it
Mhm,
might not be the easiest, clearest answer, and you might stumble across something along the way that surprises you and your provider. Like, hey,
mhm,
how that doing X, Y, and Z worked, and
mhm,
really, and you just kind of got to roll with it. So
mhm.
are there common health concerns or themes that you're seeing in your patients as you're, working through? Yeah.
Yeah, so it's kind of weird. So one of the things I test for is the MTHFR gene. It's
Mm,
made the news with Gary Brecka and a bunch of people right now.
mm-hmm.
In my clinic, all of my patients have at least one copy, except three. It's bizarre. It's supposed to only be in 30% of the population, 30 to 40%, independent of ethnicity. And in my house, it's everybody except three. And I just sit back, and every time I find a nobody who has it, I kind of go, why are you here? Like, you are
Yeah.
not as afflicted as everybody else. What am I missing? Because it is a gene that has a lot of impact in a lot of regards with detoxing, metabolic pathways, energy, dealing with anesthesia, all that kind of stuff. It hits a lot of spots. And my three people who don't have it, I just sort of sit back and go, wow, what are you doing? So that's a trend. As an expert with Ehlers-Danlos, because I live it, more of my zebra people, my bendy baddies, have found me to sort of join in with somebody who gets it, because so often we're gaslit. We're told that, you guys can sublux your joints, it doesn't hurt, or, you just pop yourself back in, or whatever, wear some compression socks, eat some salt, you're fine. That is not remotely close to the lived experience of my people. So I've got a lot of those people. I've got a lot of people who've got autoimmune conditions. I have a lot of those, to include autoimmune conditions in the presence of Lyme or Epstein-Barr. So,
Mm.
and there's a lot of that. Epstein-Barr is the great confounder. Every time I see it on the lab, I just go, oh, nuts, not again. Like, here we are, because it's just a harder workup. Because one of the first things you got to do is get that to calm down, because it's the horse that kicks everything. So
Mm.
there's a
And
lot of those.
I'm glad you brought up Epstein-Barr, because that is, I think, some areas of confusion in the medical industry. I can recall going to the doctors and saying, the numbers keep rising, and y'all are saying I'm perfectly good everywhere else. And they say, no, 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 that was a past infection. It doesn't matter. And I'm like, really? Because those numbers are like up past 700, and they weren't
Mhm,
when we were starting this whole shenanigan. And so I'm
mhm.
glad you bring that up, because I think it is a very misunderstood space. And I see a lot in the holistic space that people pay
Yeah.
more attention to it, which I think is huge.
It's the great confounder. Like, when I see somebody who's got any autoimmune stuff, it's one of the first things I draw. So, do you have true autoimmune conditions, which you could, and is your whatever your process is, Hashimoto's, Graves, whatever, Sjogren's, whatever, is it independently just a disaster, or do you have Epstein-Barr in there mucking about? Like,
Hmm.
if we have that, now we've got to treat them both. And we've got to
Right.
sort of get the system to cool down before we can start to treat the Sjogren's, to treat the other condition that actually needs more needs, because it's standing up, and you've got Epstein-Barr and they're just kicking everything around.
Hmm.
So,
Hmm. Yeah, love it. So we're going to jump into a little holistic health talk for a
okay,
second here. I know we've been
I'm here.
talking about it throughout, but were there any really profound holistic tools or techniques you uncovered along your journey that were a game changer for you?
The big one was understanding my electrolytes. That was a big one. And
Hmm.
every time I told somebody my electrolytes were off, they'd look at them and they go, well, you're in the normal range. And I was like, yeah, but okay, stop it. Normal is not normal. So let me talk about this for a second. So let's talk about what a normal is. So I'm going to talk about vitamin D. Vitamin
Hmm.
D is probably one of the most bastardized labs out there. The poor vitamin D. We need
Hmm.
tons of it. And I'm in New England. The rays don't get uh, direct enough, even in the summer, to get enough vitamin D to be reasonable, to be good. I mean, I'd have to be half clothes every day, all day from now till September to maybe get my levels up to normal. And at that point, I will have exposure and I'll look like a lobster. So that's not a good idea. So when they make a normal, most of the labs say, okay, we're going to take one arbitrary place in time and one arbitrary window of time, and we're going to take all the people who had, let's just say Iowa in February. We're going to take all the people in Iowa in February. We're going to look at all the people who had their vitamin D drawn in that window, and we're going to plot them on a bell curve. So you got this bell curve. We're going to cut off the extreme ends, and everything from this extreme 2.5% up, we're going to call that normal. We don't know. That's a normal curve. That's statistical analysis. You have a 95% confidence interval. So yes, 95% of the people fit in that curve. But if you took that same window of time and you did Miami, it's not the same number. It's going to be skewed higher. So that's not normal. Come on now. That's lazy math. So what is optimal? What are the levels that the body needs to do the things? So like I said, there's hundreds of reactions that require vitamin D. It's actually not a vitamin, it's a hormone. So if you look at that, what are the levels? So depending upon the lab, even around here in Rhode Island, it'll say normal is 20 or higher, 25 or higher, or 30 or higher. Mm-hmm. So, okay, which is it? Because I've got people who come in 22. So are they normal? Where are they normal? So that when you go into the literature and look at what are the requirements that the body needs, they will say for vitamin D, it needs to be 60 or higher, preferably 80. So that way you can do all the reactions. Vitamin D in and of itself is an independent risk factor for breast cancer. How many women do we know that have breast cancer? My mom, my grandma, one of my good friends, they all had breast cancer. I have no idea what their vitamin Ds were, but I can tell you, I know my mom and my grandma didn't take any supplementation. So when we have a normal lab, we have to actually ask the question, is it normal or is it lazy math? Is it optimal? Is it functional? Is this the levels we should all be at? So once you understand your labs and what is, even though it's in the normal range, is it actually normal or normal for you? That's one of the first things you can do to really start to understand. So once I understood my normals, then I was like, okay, I don't have to listen to you anymore. I know what I need, and so then from there, with my POTS, at the time there were not a lot of electrolyte powders out there. Like this is 2017, 18, 19. Now you can go, there's LMNT, there's Liquid IV, there's Noom, there's a pickleball one. There's all these electrolyte powders out there. Christ, if they had those when I was first started, it would have been much easier. So then I had to craft my own and then figure out all the foods that had it. That's why in my refrigerator there was always V8 juice and there was always coconut water, because those were high in the electrolytes I needed. And as much as nobody should reasonably chug 3 cans of V8 juice when I was in a tight spot, it was that or nothing to stop my nonsense. That's what I did. And so figuring out what I needed, understanding my labs was critical. And what was good for me was not necessarily good for that guy. So
right. Very helpful information. And I'm glad that you did shed some light on vitamin D, because that is a topic that comes up all the time. So for those that are listening and considering holistic health approach to their wellness plans and just their way of living, where do you recommend they start? And I know that's hard because everybody's an individual, but if you had to give a blanket, how do they get into that space if it's new for them?
So, I mean, obviously, if you already have a primary care provider, like make sure that they're not meeting your needs. You're already in with a provider. If they're meeting your needs and they're attentive and they're thoughtful, great. I applaud you for finding that person. And it's not that those people don't exist out there. There's just not a ton of them out there. So then it comes down to, okay, talk to your friends. Talk to people at places where alternative medicine for people could be. Yoga studios, health fairs. You could Google search like functional medicine and wherever you live. And I would probably cast a big net, like functional medicine in Rhode Island, in Florida, in Delaware, wherever you are, and see what's out there. And then from there, get really picky, start to, look at their credentials. What have they been through? What have they what sort of education have they had? And then go for a meet and greet. Any doctor worth their salt will give you 30 minutes at least of a no charge consult, whether it's in person or virtual, just to have you pick their brain. understand their philosophy, where do they come from, what can they offer, do you have the things that that person needs, can you even get access to them, or do they know a guy, like do they know somebody who would be better suited for you, do you have a lot of orthopedic and connective tissue disorders, do you need to go see this guy, do you have a history of cancer? Okay, so there are definitely going to be functional medicine people who are going to be way more comfortable with cancer. So ask around and go for the free consult. If they have it, what you're going to do? You lost 30 minutes, and now sometimes knowing what you don't want is as valuable as knowing what you do want and what you're willing to have. So,
Love it. Perfect. Thank you for that. And
yeah, of
so
course.
we're getting close to the end, but I would like to give you an opportunity, of course, making sure we preserve the confidentiality and
Mhm.
follow all the HIPAA rules and all the things. Do you have a patient story that you could share with our listeners? Just a success story or two about individuals you've worked with and how that turned out.
I've had a bunch of people that have made a lot of progress and their cases aren't done because as
Hmm.
we pick away stuff, we learn stuff. So I've had people where we figured out the reason why they miscarried. They had several miscarriages. We couldn't figure out why. We drew labs and we looked at them and we're like, these are the things that happened. And I can't explain why other providers didn't do it. That's not my monkey. I can't do that. But I can tell you these are the things that put you at extreme risk for a miscarriage. And so I give them that information. I give them the proper way to override those things and how to fix them, and they go about their merry little way. I've had people who've come in where they've been on every med in the planet, for their diabetes, their heart disease, and we go and I look at their labs and go, okay, well, these are all causing you terrible amounts of side effects. Let's throttle these meds back to the point where we get the intended effect without the side effects. Cool. Let's do that. And so that's for people who are chronically ill, like my diabetics and stuff like that, like they need tweaks. I can't go throw out all their stuff because that's silly also. But if I can modify their plan enough so they get more benefit out of it, then we do that. I've got a whole bunch of people on the autoimmune issues where they just come in and they need a touchstone. I did the following things. What am I doing? Did I do everything right? Yes, you're totally fine. Keep going. And sometimes the best I can do for people is to keep being the cheerleader. Like
Hmm.
when you have a doc you only see every 6 months, A, they don't know you, and B, they certainly as heck can't cheer for you and they can't tell you
Hmm.
keep going. you
Hmm.
know for some people I'm the person that they run everything of their specialists off of because they know that I am a straight shooter. I'm not involved with that medical group. I will tell you exactly what I know from my experience. And so those end up being success stories because I'm making them make very thoughtful guided decisions. And while that is not the great revelation, we resolve somebody's Sjogren's disease or made their MS go into remission completely, their life is better. And that is enough because some of these conditions are just never going to go away. People with MS, they're always going to have MS. People with diabetes are always going to have diabetes. But can we make it better? Yes, we can totally make it better. And they don't have to be in the pigeonhole where they're come in every 6 months because then nobody knows who they are. Like
Right.
the personal connection matters. I
Hmm.
care. I
Hmm.
show up. I even have patients where I make home visits to because that's what they need. They need me to show up at home because they can't come out, or they are either they're bedridden or their anxiety is so bad, or they're like, I can't do it. Okay, cool, I'll be there. Give me 20 minutes, I'll be there.
Right. Oh, I
So
love that. Well, Dr. Wendy, we've covered so much in this episode, and I'm so excited that you were able to share the importance of the persistence when it comes to personal health. If you could share one message with our listeners on this topic, what is your message to the world?
you are not alone. You've never walked that, you're not walking a path that nobody else has walked before. Somebody else has walked that path before and is willing to walk that path with you, and you're not alone. And when you get medically isolated, when you've got conditions that just scare the hell out of you, you feel like you're alone. You feel like you can't even tell your partner, your friend, whatever, all the nonsense you're going through. And as it keeps rolling, you're like, I'm still dealing with this. So then you feel bad that you keep babbling on about, your condition and you're afraid that everybody's going to leave you. Keep going. There are people who will listen. There are people who want to help you. So I can't say it enough. Don't quit. There are people out there who will listen. So, and you will have people who will leave your life because you are chronically afflicted with whatever you've got, and they're not your people for that moment in time, and maybe they were there for a period and now they're not. Some people are there, some people are in your life for your whole life, and some people are only there for a period. And sometimes you have to learn the lesson that comes when they leave, and sometimes that's really hard, to just keep going.
Yes. Oh, that is profound. Thank you. Dr. Wendy, please share with our listeners how they can get in touch with you
Sure.
if they'd like to connect or reach out for more information.
Sure, you can go out to my website, which is www.lac.net. That's my website. You can send us a message on there, or you can call the office at 401-854-7955. You can leave a message after hours, and we'll look forward to talking to you. And we're on all the socials. We're on X and Facebook and LinkedIn and Nextdoor and Instagram, so you can always hit us up there. We put out lots of content. My sister-in-law who works for me makes all sorts of crazy videos with me that makes me look silly, and I'm just here for it. So,
Love that. That's awesome. Well, for our listeners, thank you so much for taking the
of
time to
course.
listen to this episode of Surviving the Human Experience. Until next time, be well and stay blessed.